Okay, so we're diving into menopause hormone therapy today, MHT. Big decision for a lot of women out there. And knowledge is power, right? We're taking a deep dive into a journal article from the Journal of Clinical Pharmacology. They're covering all the need-to-know stuff about estrogen, progesterone, even some newer options on the scene.
And it's not just about hot flashes. This article really digs into the bigger picture, how menopause affects women's health overall. We're talking bone health, heart health, even brain function. It's all connected.
I was blown away by a statistic in this article. Apparently, over 50 million women, just in the U.S., were projected to be postmenopausal in 2020. That's
It
huge.
is a staggering number. And this article does a really good job of, addressing those concerns that a lot of women have, especially after those big women's health initiative trials, those WHI trials back in the early 2000s.
Oh, yeah. Those trials really shook things up. I remember a lot of women were really anxious after that.
Yeah. And, it's understandable, but it's really important to remember what those trials were focused on. They looked at oral conjugated equine estrogen,
Yeah.
often combined with MPA, and it was all about preventing disease in older women. They weren't even trying to manage those everyday symptoms that women experience.
So it wasn't the whole picture when it comes to MHT.
Exactly. One size does not fit all. You have to consider the different types of hormones and how they can be taken, the delivery method. It all makes a difference.
Okay, so let's unpack that a bit. The article really dives deep into estrogen.
Yeah.
Seems to be a major player in all this.
It is. Estrogen is absolutely key, but it's all about how it's delivered. That can make a big difference.
Okay, I'm all ears. Tell me more about these delivery methods.
Well, you've got options. You can take estrogen orally, obviously, or you can absorb it through your skin with patches, gels, there are even vaginal applications. But, and here's the thing, each method affects your body differently, even if it's the same type of estrogen.
It's about finding the right delivery system for you.
Exactly. So, for example, if you're concerned about your liver, maybe transdermal estrogen, the patches or gels, would be a better choice because it bypasses the liver.
Good to know. I'm all about options.
Me too. And when it comes to estrogen, there are a lot. This article talks about how oral estradiol, especially micronized estradiol, is absorbed much faster.
Okay, but so what? What does that mean for the patient? What's the takeaway for me?
It could mean fewer side effects
Yeah.
or maybe a lower dose to get the same results.
Not all estrogens are created equal.
Exactly. And, it's the same with progesterone, the other big hormone we talk about with MHT.
The article talked about that too, right? Not all progestogens are the same either. Some seem easier on your heart or maybe less risky when it comes to breast cancer. It's a lot to consider.
It is. It's really important to know the differences. For example, the article talks about how drospirenone might be gentler on blood pressure. Then you've got micronized progesterone, which is, bioidentical. It's structurally the same as what your body naturally makes.
So it's like finding the right key for the lock. You want the hormone therapy that's going to work the best with your own body.
Yeah, exactly. And, there are always new things coming out, like these medications called estrogen receptor agonist antagonists. We call them ERAs.
ERAs. Sounds kind of intense.
A little bit. Think of ERAs like estrogen with a split personality. So they act like estrogen in some parts of your body, like your bones, but they block its effects in other places, like the breast tissue or the uterus.
Oh, wow. So they can be more targeted in how they work.
Exactly. And this article talks about one in particular called bezadoxaphene, we call it BZA for short, that's combined with estrogen. Seems promising for managing hot flashes and bone health.
Okay, so we've covered estrogen, progesterone, but what about testosterone? I know it's often associated with men, but it does play a role in women's bodies too, right?
Absolutely. And some women going through menopause, they see changes in their sex drive. It's natural to wonder if testosterone therapy might be helpful, right?
Makes sense. So what's the deal with testosterone therapy for women?
Well, right now, there aren't actually any FDA-approved testosterone products specifically designed for women, although there are some options out there.
So even though there isn't like a specific testosterone pill for women, going through these changes, are there things that women can do?
You're right to bring that up. It's important for women to know, right?
Yeah.
What's out there. This article mentions one. It's a combination therapy. It's got a low dose of testosterone in it, and it's combined with estrogen. It's been around a while. Might be worth talking to your doctor about it.
So it sounds like the whole testosterone therapy for women thing, it's still being explored.
It is. But one thing that's maybe not talked about as much are those uncomfortable vaginal symptoms that a lot of women experience during menopause. So that's where we do have more, I guess, established choices, I guess I would say, particularly when we're talking about local hormone therapy.
Yeah, it's not always the easiest thing to talk about, but vaginal dryness is a real concern for a lot of women.
Hmm.
So are there effective ways to address that?
Absolutely. This article talks about how vaginal estrogen is actually a very effective treatment option. And the good news is it seems to mainly stay where it's needed. So minimal, like systemic effects. That can be really reassuring, I think, for a lot of women who maybe are hesitant about hormone therapy impacting their whole body.
Like a more targeted approach.
Exactly. And there are options, right? You've got creams, you've got rings, you've got tablets. So it's about finding what works best for each individual. And then beyond vaginal estrogen, there's vaginal DHEA. So that uses a hormone that your body naturally makes.
So it's like replenishing what we might be losing as we age.
Yeah, exactly. Replenishing. I like
Yeah.
that. And then there's ospemifene. It's an oral medication. It acts like estrogen in the vagina, but it blocks the effects in other parts of the body. So that's another route for women who maybe prefer to take a pill.
Wow, so many different ways to approach it. That's incredible.
Hmm.
All the research and development that's gone into all of this.
Yeah, I know it's pretty amazing. And it all comes back to those different delivery methods we were talking about earlier. They play a huge role in all this.
Right. You were saying that, taking estrogen orally as opposed to patches or gels, it can impact the liver. So how does that actually work?
Well, when you swallow estrogen, it goes through your digestive system and then goes straight to your liver to be processed. That's called the first pass effect. So, this first pass through the liver, it can actually increase the production of certain proteins. Some of those proteins are involved in blood clotting.
Okay, so for someone taking oral estrogen, what does that actually mean?
Well, it could potentially increase their risk of blood clots, especially if they have other risk factors like family history, if they smoke, if they live a more sedentary lifestyle, or other health conditions.
So those women might want to consider transdermal estrogen, the patches or gels, because it bypasses the liver.
Absolutely. It's a conversation to have with their doctor, right?
Hmm.
Weigh the benefits, weigh the risks, and figure out what makes sense for them.
This is what I love about these deep dives, just how much goes into choosing the right medication and the right delivery method for you as an individual.
It's not just as simple as popping a pill, right? It's understanding the nuances of how these things interact with your body. And speaking of interactions, oral estrogen can also impact thyroid hormone levels.
Oh, right, and thyroid hormones are really important for regulating metabolism. So how does oral estrogen actually affect that?
Okay, so think of your thyroid hormone, right? It's like a car trying to get to its destination. Oral estrogen can actually increase this thing called thyroid binding globulin, and that's like another car that's now taking up space on that road.
So less thyroid hormone can actually reach its destination even if you're taking your medication.
Exactly, it gets like soaked up along the way. So women on oral estrogen, if they're also taking thyroid medication, they might need their dosage adjusted.
Wow, it's such a balancing act in there.
It really is, and that's why individualized treatment is so important. It's not just about minimizing the risks, but also really maximizing those benefits.
Absolutely. So how does this whole individualized approach apply to the benefits?
Well, the article brings up an interesting point about the timing of when you actually start hormone therapy, and they were specifically looking at heart health.
Oh, interesting. So there's an optimal time to start hormone therapy for the best heart protective effects.
It's not 100% guaranteed, but there's definitely research suggesting it's something to consider. So, the timing hypothesis is what they call it. It suggests that women who start hormone therapy closer to menopause, meaning within 10 years of their last period and before age 60, they might have a better chance of seeing those heart benefits compared to starting it later.
Interesting. Why is that?
Well, researchers think that starting earlier might help women maintain those healthier blood vessels, more flexible blood vessels, which we know is really important for good heart health.
It's like preventative maintenance, right?
Yeah,
It's easier to keep things running smoothly than try to fix them later.
exactly. There was one study that found women who started estradiol, which is a type of estrogen, within 6 years of menopause had slower progression of atherosclerosis.
And atherosclerosis, for those of us who don't speak doctor, that means what?
That's the buildup of plaque in the arteries. And that can lead to all sorts of heart problems down the line.
So starting hormone therapy earlier could actually slow that buildup down.
It's a big deal. But again, it all comes back to it's not one size fits all. Talk to your doctor, consider your risk factors, your medical history, and what feels right for you.
Now, another thing I know a lot of women are concerned about is the link between hormone therapy and breast cancer.
Hmm.
I imagine that weighs heavily on a lot of women's minds.
It does, and rightfully so. And the article does a really good job of addressing this head on.
So what's the connection?
It's complicated. as you can imagine.
Yeah.
But the gist is this. The type of hormone therapy, the dose, how long you take it, all those things seem to play a role in the risk.
So there are no easy answers here.
Yeah.
Anything that stood out to you in the article?
Yeah. So using estrogen alone without any progesterone might actually be linked to a lower risk of breast cancer.
Wait, really? That's kind of counterintuitive. Why would that be?
I know, right? But here's the thing, estrogen alone, that's typically only an option for women who have had a hysterectomy. Because if you don't have progesterone in the mix, then estrogen can increase the risk of uterine cancer.
Ah, okay. It's all about that balance.
Always. Now, for women who are taking estrogen and progesterone together, the type of progestogen seems to matter.
Right. Like we were saying earlier with the drospirenone and micronized progesterone.
Exactly. Studies suggest that some of those synthetic progestogens, like MPA, might be associated with a higher risk of breast cancer compared to natural progesterone.
So choosing the right type of progestogen could potentially help women manage that risk.
Potentially, but we need more research to say for sure. And this is another example of why those open and honest conversations with your doctor are so important.
It's about being in the driver's seat, advocating for your health and not being afraid to ask those tough questions.
100%. Knowledge is power, especially when it comes to your health.
Absolutely. And, while we're talking about those key health areas for women, we've got to circle back to bone health
Mm.
because that's a big one, especially during and after menopause.
Huge. Bone loss is definitely something we worry about. It can really increase the risk of osteoporosis. And nobody wants to deal with fractures, right?
Oh, definitely not.
Yeah,
And it's about more than just broken bones, isn't it? It's about staying independent and, just your overall quality of life as you age.
100%. And this article does a really good job of explaining how hormone therapy can actually help protect your bones and keep them strong.
Okay, good. So how does that work? What's actually going on in there?
So think of your bones, right? Like a construction site, you've got all this activity, stuff being built up, broken down, it's dynamic.
There's not just these static structures. There's actual stuff going on in there all the time.
Oh, yeah, always. And estrogen, it's a key player in all that. It helps slow down the breakdown process so your bones can stay nice and dense.
Got it. So when estrogen levels naturally decline during menopause, that breakdown process can speed up.
Yep. And that's when the risk of osteoporosis and fracture starts going up.
That makes sense. So
Yeah.
hormone therapy can kind of put the brakes on that and keep things more in balance.
You got it. The article talks about all sorts of studies that show that hormone therapy, whether it's estrogen alone or estrogen with progesterone, can really help slow down bone loss. And that means fewer fractures.
That's great information, especially for women who might have other risk factors too, like family history or maybe other medical conditions.
For sure. It's always best to have that conversation with your doctor about your personal risk level and what makes sense for you.
We've covered so much in this deep dive. And honestly, I have to say, when you hear about all the different hormones and dosages and delivery methods,
Yeah.
it can feel kind of overwhelming. At least it does to me.
I hear you. There's definitely a lot to take in.
So for someone listening who might be feeling that way, what would you say is the most important thing to remember? How do you even begin to make a decision?
Honestly, having a doctor you trust is key. Someone who can really listen to your concerns, answer all your questions, and guide you through all this information.
It's like having an experienced guide, right?
Hmm.
To help you navigate all the tricky terrain.
Totally. Remember, hormone therapy isn't a one-size-fits-all kind of deal. It's about really looking at the big picture, your medical history, your family history, your personal preferences, weighing the benefits and the risks.
So it's not just about reading medical journals,
Yeah.
right? It's about having those real, honest conversations with your healthcare provider.
Absolutely. And remembering it's an ongoing conversation, too. Your needs might change, new research comes out. It's always evolving.
I love that. It's not just a one-and-done decision. It's an ongoing process.
Exactly. And speaking of ongoing, we've got to talk about FDA-approved therapies again before we wrap up.
Good point. Especially with all the talk about bioidentical hormones and compounded hormones these days. So why is that so important? Why stick with FDA approved?
I think it's easy to get caught up in this idea that bioidentical sounds more natural, right? But here's the thing. Whether it's FDA approved or compounded, those hormone therapies, they actually contain hormones that are identical to what your body makes.
So it's not so much about the hormones themselves, but how they're made and regulated.
Exactly. FDA-approved therapies, those go through a ton of testing, safety, purity, effectiveness. And you have all that data about potential risks and side effects, how they interact with other meds. You don't always get that with compounded hormones.
So even though compounded hormones might seem appealing, they could actually come with more unknowns.
Potentially, yeah. Sticking with FDA-approved options gives you that extra peace of mind, that extra layer of safety.
Well, this has been amazing. We covered so much ground, the ins and outs of hormone therapy, the different types, the factors to consider, why talking to your doctor is so important.
My pleasure. I think the more information we can get out there, the better. Give women the power to make those informed choices, for their health, both now and in the future.
Absolutely. And for our listeners out there, just know you are not alone in this. There are amazing healthcare providers out there, support groups, great resources online. Don't hesitate to reach out and find what you need.
That's right. You've got this.
Now, for that final takeaway, I think it's important to remember this. Hormone therapy can be really life-changing. I mean, it can make a big difference in managing those pesky symptoms and protecting your health. But it's not the whole picture. Don't forget about all those healthy lifestyle choices, too.
Oh, they're crucial. What you eat, how much you move, managing stress, getting enough sleep. All of that plays a role in how you feel during menopause.
Taking a holistic approach.
Right, exactly. It's about thriving, not just surviving, right?
Hmm.
During menopause and every stage of life.